people that you can actually audit. But standard-based audit is talking about auditing your own work. It is like you looking at what you do in your facility and then trying to bring out standards that you are going to work with. So that is what the standard-based audit is all about. Here we are developing standards, and hopefully at the end of the day, each facility will develop standards that they can take away and try to implement to get back. So the objective of this module 4 is to learn about standard-based audits as a method to improve quality, to practice how to develop standard-based audits. Today we're going to have a lot of group work and a lot of presentation to discuss and share ideas on how standard-based audits can be introduced, and then to demonstrate how to carry out these audits. We have only 2 lectures, but in between we have a lot of group works, and today we're going to work in smaller groups, not like yesterday that we had only 2 groups. Okay, so let's try to have standards, and then link standards to evidence, try to complete standards, and then we'll do some exercises. So I hope you remember, this is the last module of our QI training. Remember, we have 4 modules. We did master debt, we did the national debt, we did junior debt, and then this one is standard criteria-based audit. So let's try and find what are standards. Only one topic. So people will need I'm always coming this way. Maybe because these seats are empty, the secretary is absent actually. So read. What is that definition?
What are standards? Standard means an agreed upon level of performance that specifies what action should be taken by whom, or statement of the best quality of care that a service aims to offer.
Okay. So just think about this definition very well. It is an agreed upon level of performance that specifies what action should be taken. So it is an agreed level of performance. Just think about that. It's something you sit as a group in your facility, you agree. This is what we want to achieve in this facility. And then you work towards that. That is what standards are all about. There are some other definitions by objective with guidance for its achievement, given in the form of criteria sets which specify required resources, activities, and predicted outcomes. So here, this definition is just telling us that you have an objective, you have a criteria on how to achieve that objective, and then you have specified what resources you require, what activities you should carry out to achieve the outcomes that you're desirable of. By the time, I know this is just academic, I don't like academic definitions, but by the time we start giving examples and you go break out to do the exercises, you will see how easy it is. And I feel for me, I love standard-based audits because once you are able to work on how you do things in your facilities, ensuring that at all times you are trying to achieve a certain standard, by the time you have done that, you see the need for other audits will start reducing. Okay, there's another definition here. It's by Department of Health. It's UK Department of Health. It is a means of describing the level of quality that healthcare organizations are expected to meet or aspire to. So this standard is just talking about, how you see patients and what quality of care you want to see. So the importance of standard is, it is a benchmark. I hope you know what a benchmark means. Okay, let's see who comes early here. Let me give a very simple example. Who did I meet? I met the two of them here. So let's say their time, the time they come, that is our benchmark. Whoever comes before them is early, too early. Whoever comes after them is late. So that is your benchmark. You have, like in your facility, you say every woman that comes for antenatal care should stay for only 30 minutes. Just 30 minutes, nothing more. So whoever, what you're aiming for is 30 minutes or less than 30 minutes, isn't it? So whoever stays more than 30 minutes has crossed that your benchmark. It's just something, you have a standard somewhere and then you're hoping to achieve that standard or even surpass it. So that's what we're trying to do. So when you do that, you get the best achievable performance. And then usually, since we're talking about healthcare, you use the best available evidence. You not just sit and decide on your own that this is how I want to manage patients or this is how I want to do things without evidence. You have to use the best available evidence. One thing with this type of audit is, once you start, like let's say you pick one aspect of your care, maybe how you manage eclampsia in your facility, for example. You put some certain criteria to ensure that if women come in with eclampsia, by the time you've put your benchmark, this is what you want to achieve your desired result. You ensure that everybody that comes into your facility receives that treatment that you have decided upon. You see, with time, you would have taken care of all women that come in with eclampsia. You don't have to go back there again. You can improve on your findings, definitely, but you can now move on to another thing. Maybe let's say all women that are admitted that develop postpartum hemorrhage or something. By the time we look at examples, you understand this better. So still the importance of standards is that you have agreed processes of care in different situations. For each care, you will pick one situation. When we break out to do the exercises, you will see. For each care, no matter how small it is, maybe what you want to look at is just privacy for the patient. Just that is the only care. The standard I want is that patients will have adequate privacy when they come to this facility. So that is one aspect of your care that you can just pick and work on. And the good thing about this standard is that it gives staff support to do the right thing at the right time. Like I said yesterday, we assume a lot of things. You assume that people know what they're supposed to do. But if you don't tell them, if they don't have rules or they don't have policies, they don't have guidelines, sometimes people don't know what they're supposed to do. And if you don't have standards, then what are you going to measure your practice on? Because you must have, this is the way it is supposed to be done. You know that if it is not done that way, then you have to aim at doing things the right way, isn't it? So it is always good to have standards. I think that's something that is really lacking. Yesterday, I'm having a lot of you talk about SOPs. It's the same thing. It's the same thing. Only that here, you do have a plan on how you want to make things work. Based on the best possible evidence. This is all English, but soon you will understand what I mean when I give you examples. And then criterion is an item or aspect of care necessary to achieve that best practice that you want to have. Statement of objective that you want, the broad objective. This is what I want to achieve. Then you identify, you remember in our last training, you remember we talked about structure, process, and outcome. So when you're giving this broad statement, this is what I want to achieve at so time. The next thing is, you look at what structure do I need in place for this thing that I want to achieve to happen. What structure do I need? You remember the structures we talked about before. Policies, equipment, staff, even your duty roster that you make is all part of the structure. Then the process is what do you need to do for you to achieve this broad objective that you have. And then the outcome is what you hope to achieve at the end of the day. Because you've already measured your practice. At the end of the day, if you've measured your practice, you've seen where your problem is. So if I change these things, I bring this structure, and I do this certain processes, what am I hoping to achieve at the end of the day?